How does alcohol or nicotine use affect brain health after a stroke? When we think about recovery after a stroke, it is important to consider how lifestyle choices, particularly alcohol and nicotine use, can influence brain health. Both substances can have significant effects on recovery and long-term outcomes for stroke survivors. A stroke happens when blood flow to part of the brain is interrupted, leading to brain cell death and potential long-term damage. Recovery can depend on several factors, including the severity of the stroke, the area of the brain affected, and the individual's overall health. Alcohol and nicotine use can either support or hinder this recovery process. Alcohol can have complex effects on the brain and cardiovascular system. Chronic or excessive alcohol consumption is linked to an increased risk of stroke, heart disease, and liver disease. After a stroke, alcohol may further impair brain health in several ways. It can reduce blood flow by causing irregular heart rhythms and weakening blood vessels, increasing the risk of another stroke. Alcohol is also a neurotoxin that can damage brain cells and disrupt connections between them, worsening cognitive deficits and emotional issues that are common after a stroke. Additionally, alcohol can interfere with sleep, increase feelings of depression and anxiety, and reduce motivation for rehabilitation, which are crucial for recovery. Furthermore, alcohol use raises the risk of falls and injuries, which can lead to further complications. Nicotine, primarily consumed through smoking, also negatively affects brain health after a stroke. It causes blood vessels to constrict, reducing blood flow to the brain. This is particularly harmful for stroke survivors as it can increase the risk of another stroke and slow the healing of damaged brain tissue. Smoking also promotes blood clot formation, which can block blood vessels and lead to another stroke. Moreover, nicotine can accelerate brain aging and cognitive decline, making it harder for stroke survivors to regain lost functions. Smoking reduces the amount of oxygen in the blood, which is essential for brain cell repair and function after a stroke. For stroke survivors, reducing or eliminating alcohol and nicotine use is highly recommended by medical professionals. Seeking support for quitting, such as counseling or support groups, can be beneficial. It is crucial to follow medical advice and consult healthcare providers before making any lifestyle changes, as some medications for stroke recovery can interact with these substances. Focusing on healthy alternatives, like physical therapy, a balanced diet, and social activities, can significantly support brain health and recovery. Monitoring mental health is also important, as stroke survivors are at a higher risk for depression and anxiety. Reducing alcohol and nicotine use can help improve overall mood and well-being. In summary, alcohol and nicotine use after a stroke can worsen brain health by reducing blood flow, damaging brain cells, and increasing the risk of another stroke. Both substances can interfere with recovery by impairing cognitive function, increasing the risk of falls, and reducing motivation for rehabilitation. Therefore, reducing or eliminating their use is critical for stroke recovery and long-term brain health. Stroke survivors should work closely with healthcare professionals to develop a personalized plan to manage these substances and support overall recovery. Always consult a healthcare provider for advice tailored to individual situations.